This panel is extremely special because we have a guest that's actually not in Hong Kong, which is classic for 2020, right? So can we have Karen? Karen, are you there?
Hello, hi everyone. Hi, can you hear me?
Hey, Karen. So Karen is joining us from Cairo, Egypt. So I'll let Karen introduce herself as well. Go ahead, Karen.
Sure. Thank you, Rohit. Good to see you, Rebecca and Jessie. So we have made it. So yeah, I have the privilege of not having to wear the mask since I'm joining virtually. So I'm Karen. My background is in health, public health and global health. So I have worked in the NGO sector in Hong Kong, mainly for marginalized communities, including refugees, asylum seekers, ethnic minorities, low-income working families, and also carers. And so mainly in the area of health policy and advocacy. And then I've also worked a while in the Hong Kong government as a policy analyst, again, focusing mainly on health policies, also a bit of welfare policy and education policy. And then I have moved into the international arena. So currently I'm with the WHO, Eastern Mediterranean Regional Office, based in Cairo, working mainly as part of WHO reform, looking at countries in our region in terms of their country functional reviews. So on that note, I'd like to just add a footnote that today I'm speaking on behalf of your personal capacity. So all these are my own. And also just one more footnote, because in Cairo, the internet has been unstable, so I've joined other panels where I disappear. So if that happens, do not panic. My fellow panelists and moderator will carry you through. So I'll stop here. Thank you once again for inviting, and I'm looking forward to the discussion.
All right, yeah, I mean, having done so many of these events online, this happens all the time. So don't worry, guys. If Karen tunes off, I have like a list of jokes memorized to kind of help us get through the time. All right, but anyway, so let me just start by sort of going through the entire agenda for what we're going to do over the next a bit more than an hour. As you know, we have two themes, i.e. urban health planning and resilience 101. So we've actually prepared one sort of thematic question, which we will go through with each panelist, after which there will be some time to do some discussion. And then we'll hopefully go through both of these themes one by one. And then after that, we will conclude with maybe some of your questions. So if you have any questions, please put them in the chat for us to get back to, and maybe some closing thoughts. Hopefully we can have an organized and constructive discussion and something everyone can enjoy together. All right, so are you both ready?
Yep.
Yeah, you guys are ready for my questions. Fantastic. All right, I like that. Okay. So let's start with the first question. This is related to urban health planning, which is the first theme of our discussion today. How have you shifted gears to the new normal that has come about as a result of the COVID-19 pandemic? How can we plan ahead to improve efficiency? I mean, I know, just to give you guys a bit of thinking time, I know all of you serve different kinds of groups, you're in different capacities. So what have you learned regarding urban health planning? How has that, this new normal, us tuning in this way with someone online and in person at the same time, how has this changed the way you guys do things? And what can we learn from it? And how can we get better from it? Yeah, so who would like to go first? I mean, I wish I could say ladies first, but they're all ladies. So it doesn't really help me much.
I'm the older one, so let me talk first. Respect for the elderly. As an entrepreneur, during the pandemic, of course, I will look at how the social enterprises are doing. So, in fact, a lot of them are facing a lot of uncertainties as far as the business is concerned, as everything has come to a standstill. But during this process, I've been helping our social enterprises to change their thinking and try to do everything physical to online. Now we have community tours being held online. We have education and training being held online as well. This is not easy because just imagine, like this summit, we have to turn everything online as well.
Right, and for the elderly too.
Yeah. And then for the Golden Age Foundation, because our focus is on smart aging, obviously we are looking at our beneficiaries because many of them are being stayed at either their own house or at the elderly centers. For the elderly centers, in the early stage of the pandemic, it's still okay because the management of the most elderly homes, they have closed their doors to everyone. So in Hong Kong, there was very stringent control on elderly homes, and the mortality rate was 0. That was very good until in the middle of the year, when some of the working staff there contracted the virus and it began to spread to the elderly. But then for our organization, we realized that it's important that we connect people together. I think during the time of crisis, connectedness is very important. People are angry, they feel isolated, many of them don't have updated information. So immediately we have developed a number of webinars. So we invited professionals from different fields, notably from the medical field, to give us updated information, how they work in the emergency ward, what are the frontline staff doing, and what kind of perspectives they are having, etc. So we do this online so that people who are being stayed home or at their offices, they would be able to get more updated information. And also in August, we have organized an online summit, which is the Golden Age Summit, which was used to be a huge summit physically held. So this year we have it held online. We could connect with people from different parts of the world and also from different age groups. So we find all these changes, even though very daunting, however, people could adapt to it fairly quickly, except for the very vulnerable ones, like the very old age people who may not be tech savvy, and some of them don't even have the Wi-Fi access, and also the handicapped people, the disabled people. Again, they won't have Wi-Fi connection at their places, and some of them don't really know about the digital way of connecting with people. And the other sector is women, because not only because I'm a woman, but because women traditionally bear the greater responsibility of looking after the family. So just imagine that many women have to look after their children, could have to study at home, and also look after the elderly who also have to stay home as well. So they are struggling with this, but a lot of NGOs are providing immediate help to them with some online teachings and also some sort of visits from time to time.
Wow, I think that's a lot that the Golden Age Foundation has been doing, and obviously it concerns a lot of medical and healthcare, which obviously doing that a lot, I think our system has done such a fantastic job, and even with the way the old age homes have been managed and how we've kind of kept things on the low regarding mortality rates, I think Hong Kong has been an example for the world, and contributions like that are very meaningful to that process and to establishing our role as almost in a way we're a front runner in terms of managing situations. Yeah. Jessie, why not you chip in the question as well?
So as Rebecca mentioned, COVID has gave us a new normal, and in a way it's moved a lot of things online, and it's been a huge advancement for Hong Kong in terms of technology, e-commerce, and things online in general. And it gave us a new opportunity because sorry, I keep hearing myself. It gave us a new opportunity for business. It gave us a chance to connect with people around the world. Within Family Mass, we actually employed a lot of people that were made redundant from the tourism industry. So that also gave us room for training for these people to learn a new skill because of our new business. Family Mass, we had to learn a lot about PPE manufacturing, which includes intensive training, and also e-commerce, which involves a lot of training of digital practices, which may be new to some people.
Mm-hmm. So e-commerce was like a new thing for you as well, right? I remember we've kind of spoken before. Why don't you tell us a bit about how you kind of got into it and like the background?
Okay. I guess it's not exactly new for me because I studied it when I was in university. I studied business management in university, and a lot of our studies included digital marketing, digital retail. So I feel like for millennials, it's not a new thing, but it's a new thing to a lot of the...
Actually, I had a catch up with our guest this morning.
Older generation.
Yes, sorry, I heard a voice. Yeah, so for a lot of the older generation, it's a new thing that we have to get used to. Zoom is a new thing. And because this was able to happen, we actually had a summer program in July where we were able to bring in some kids and taught them how to do some research online, learn about the SDGs of the UN, and they were able to search for NGOs that they wanted to support. Mm-hmm. And we organized a little trip to the factory where the kids were able to pack their own donations and send it off to the NGOs. That's
really meaningful. And that's kind of bringing it more than just about the mask itself, but also allowing people to volunteer. And it's just fostering a better community building sense. And I noticed the pin. I'm wondering if that's for the SDGs?
Yeah.
All right, right. Well spotted. I mean, I guess that's what I'm supposed to do here. Okay, let's move to Karen. Yeah, Karen, I hope you got the question. And let's hear your end on this before we can do some more discussion.
Sure, thank you. And I love the reference to the pin. So it's good that we've heard from Rebecca from the NGO sector and Jessie more on the private side. So I guess I'll try to contribute a bit more from the perspective of, from the government side and also intergovernment arena. So one of the, I think the key message or the key characteristic of COVID response in terms of, urban and city planning, health planning is really on partnerships. So traditionally, especially for the public sector, it is not as easy to work very closely with either the private sector or the civil society sector in terms of, implementation or development of policies. But with COVID, I feel like things have changed. It's actually for the better good, I think, with this year, because there's really broad coalitions, as you can see, in Hong Kong and internationally, so especially with the private sector. So, for example, everyone's, especially in Hong Kong, it's talking about the vaccines lately. So on the international level, it has been an achievement for international agencies and governments to come together to form the COVAX facility, taking into account the economic development levels of different countries and how there could be a coordination in terms of vaccine distribution and, of course, development and research. So that has been a huge success. And as well, even in Hong Kong, with our scurry for the surgical mask initially. So because it was unprecedented. So at the beginning phase in Hong Kong, there was an unhealthy competition or a rush to just grab whatever mask you can on the streets, online.
Toilet rolls as well, Karen.
So, exactly, toilet rolls as well, a lot of daily supplies. So it was great that very quickly, different sectors realized that there was a need to collaborate and coordinate. And then a lot of, for example, Jessie's and other entrepreneurs came in to quickly transfer or to redesign their facilities into mass production lines. So that was great. And the government also, had a scheme to support entrepreneurs in doing so. So that was a very quick and efficient, attempt to work collaboratively with the private sector to address the imminent needs of the community and society. And also on the mask, opportunity, it is where NGOs, I feel like, has been particularly important. So we've seen repeatedly in this epidemic, including in Hong Kong, that it really is the marginalized groups and communities that have been most at risk. And, in the SDG maxim, we say we leave no one behind. And it really is true because, in the public health arena, we talk about in terms of epidemic, we are not no one is safe unless everyone is safe. And this epidemic really demonstrates that in a painful way, I have to say. For example, in Singapore, with the migrants and in other places as well. So I think in terms of urban health planning moving forward, the COVID experience has really been a test of fire for all sectors, especially for governments, in how they could work collaboratively with non-state actors, so private sectors and NGOs. Of course, there are intricacies. So, for example, with Facebook, with Twitter, they've been very quick to jump in to help, give out the correct message and to screen out, misinformation. But there's a degree of whether they're censoring of free speech, and with the contact tracing apps, there is also some concern on privacy, data security. But I believe these are technical issues that can be addressed with frameworks. So, for example, with the WHO, we've been working a lot with non-state actors in these years, and we have developed a framework called the FENSA. So as long as I believe institutions put in place frameworks, clear guidance and guidelines where it's transparent, it's clear, then there will be a way to work collaboratively with different actors. So my take on this question is really on partnerships and innovative partnerships that traditionally have not been leveraged. And with the COVID, it has shown that there is real value in working with partners that institutions traditionally have not been working with. So I'll stop there.
Well, that's a great response. I wanted to also touch back with you, Karen. How has COVID-19, the pandemic, sort of affected what you've been doing? Like, has it dampened a step that you've been taking or anything like that? Because, like you said, you moved to Egypt just recently, right?
Yes, just 2 months ago. That's a great question. So I believe COVID has impacted basically everyone's work in different ways. So from my own experience. So for example, the unit that I'm currently placed in WHO supports country offices. So WHO has a 3-level structure. So headquarters in Geneva, 6 regional offices, and then more than 50 country offices around the world. So at the regional office, our mandate is to support country offices in addressing the country's needs and priorities, and to coordinate between headquarters, our level, and the country level to see how we could provide technical backstopping. So that is ongoing work. And COVID, in addition to, especially for units in our building here, where they work with communicable disease and health emergencies, with us, it really is to understand how countries, states respond to pandemics, given our current framework. So, for example, we have a lot of preparation. IHR, people are more familiar with these terminologies now. So the International Health Regulations, and all these different pandemic responses, health emergency mechanisms. It's always there. But sometimes I think Rebecca, Rohit, Jessie have mentioned as well. Prevention is not traditionally featured very strongly in all countries. And this COVID has really demonstrated that the point of preparedness is really to anticipate things that happen. So again, in public health, we talk about pandemics not as a matter of whether it will happen, but when it will happen.
Right.
So this COVID has really sped up. Sped up ongoing work, I would say, in reviewing mechanisms, making sure health workforce, the governments, everyone's really prepared. So I believe it is an opportunity because it shows that there is a need and there is real, value in putting resources and time and efforts into making sure that these mechanisms are strong and resilient, so that when things happen, the next epidemic or other health measures will be ready. So I think it's baptism by faith, but I think it really just strengthens what everyone's been doing so far. So yeah, I'll stop there again, and we'll see if Rebecca or Jessie has other things to add.
Sure. Yeah, I will definitely reroute the question to them. But yeah, definitely, with each pandemic coming sort of quicker in the sense the time span between, say, SARS to swine flu, to MERS, and then Ebola, and now we have COVID. So, I mean, that's actually a very positive outlook. I wanted to just highlight that. I feel not many people say that 2020 has been the best year out there, but it's definitely helped us to be more ready for what's coming up next, because as Karen so aptly put it, it's not a matter of whether it will happen, but when it will happen. So I wanted to toss this over, back to you guys over here, because you guys mentioned about how the COVID-19 pandemic has sort of changed things and how you've adapted to the new normal. Say from your experience so far, what do you think that we could take now, or what are the things that you think that we should work on so that we can have the best sort of disaster preparedness for the future, coming from both your different sectors? Yeah. So Rebecca, I mean, you said you've done a lot of work with the elderly, but how do you prepare for what's next?
Yeah, I think the COVID-19 really is a wake-up call to everyone, whether it's the government, the private sector, the NGO sector, or the average citizens. So from it, we could see that first, there should be a return to community-based entrepreneurship and community-based public health, because I think the government, even though they could do a lot of things, have proper leadership and proper policies in place. However, when we come to major crises like this, how could we provide immediate medical services, relief and assistance to the average people? So perhaps the answer is in the community. So in Hong Kong, we see that we had very good public hospital system. However, during the pandemic, it's overloaded. So instead of asking people to go to the hospitals, can we make use of primary healthcare centers? And also, instead of going to public hospitals, people could get vaccinations, of course not now, in the future. And also they could have medical equipment sent to them within the community. So I think this is sort of a decentralization versus a very centralized medical system as what is done in Hong Kong. And then secondly, I think social entrepreneurship is really important, because during the pandemic, we see a lot of citizen innovation and business innovations. For example, Jessie has been producing masks at the time when we need it most. And a lot other business, they are also thinking ways to help the people what they need. So I think in the near future, we should see the rise of a number of organizations with purpose. So because I myself has been promoting business with purpose for many years, and I've seen that a lot of entrepreneurs in Hong Kong, they really would like to serve the society, but at the same time, they could make economic benefits out of it. So these are not contradictions. It's sustainable for them to grow, but at the same time, they provide services and products that are needed by the society. And I think thirdly, for our society to be better prepared for any future risks. And this preparedness does not refine to facilities or equipment alone. It's the people who are prepared for future risks. So it means that we need to connect them digitally, and also the spread of knowledge, the spread of information, because now with the IoT and digital ways of communicating with each other, we would be able to let people get more information. I think information equality is very important, so that people, even the most marginalized groups, they could have equal access to information and to services.
Right, yeah, education is power. And as a young businesswoman with purpose, what do you have to say to that, Jessie?
I think Rebecca has pretty much touched on everything, but one thing that's very true is that we do rely on a lot of people to take, a lot of NGOs, a lot of private companies to take action. As we can see throughout this year in Hong Kong, the situation was controlled in a good way because of a lot of people taking their own initiatives to protect themselves. For example, private companies letting their employees work from home, or going into the office with AB shifts. I mean, that has, I believe, prevented a lot of trouble from happening. And with what Karen mentioned earlier, that a lot of the marginalized groups and communities in Hong Kong were actually struck the most seriously. A lot of NGOs and community organizations have actually stepped up to care about their well-being, their health, and also because like I mentioned earlier, a lot of stuff has been moved online, including education. And for a lot of those marginalized groups, the computer may not be very accessible. Internet and computer is not exactly a very accessible thing to them. So again, thank you to a lot of people who reached out to help these people.
Well, I mean, that's a pretty good way, I think, to sort of conclude this first section. So I wanted to just summarize. In a sense, we've touched upon how the three of you have been affected by COVID and how things that you've been doing have been affected by COVID. Of course, education, something I can personally attest to, has been completely revamped in a sense because of COVID. Even the medical curriculum, we're now seeing patients kind of on Zoom or, well, now more like in the wards because everyone's put such a great effort in how things have gotten together. At the same time, I see a lot of common themes from what you guys have been discussing, like the young people or actually anyone with promise and purpose coming in to take charge of things, to take charge of their health, to take charge of the community. And I think that's a very reassuring sign. In the sense, Hong Kong is like a phoenix. We've been through SARS and we've learned our lessons and we've sort of taken them forward. And I think it was really, really great to see how we will take in the next challenge. In terms of urban health planning, our next step will hopefully be to start vaccinating and onboarding the vaccine into Hong Kong. That will be the next step for us. And I think that will be the next part of this learning process. So I think definitely the pandemic is hopefully on the decline. And we can take some positives, like Karen said, from 2020, as well as some of the other key learning points as we move ahead into 2021. Because the numbers may change, but we have the same situation at hand. We still have a lot of work to be doing, but definitely as a community, Rebecca, as you said so aptly as well, as a community, we'll be able to pull it off. So that's our first theme on urban health planning. So let's move on to the next discussion question. All right, so the three of you, I hope you guys are ready. Let me read out the question. So the question surrounding resilience is as thus: how have you been able to foster resilience among your beneficiaries and communities? And how can we build on these efforts to reach the next level? Of course, we've had beneficiaries across the board, from people wearing masks in Hong Kong, the young people that you've been targeting. You should probably tell us a little bit more about the social media, how you've been using that, or maybe how else we've been able to build resilience. The same way, Rebecca, it's so inspiring to see the work with the elderly. How can we sort of take that, and how are we really building resilience for these people? It's one thing to plan for the next step ahead, which is what we've touched upon. But as Karen would know, we would definitely like to hear a lot more of how Egypt is, say, different from Hong Kong, or other countries are different from Hong Kong. Of course, you're not representing anyone else other than yourself today, as you said. So let's have a go. So Karen, maybe I could start with you this time.
Sure, no problem.
Yeah.
In terms of, I think that is a great question because, with the experience of, Jessie, Rebecca, and myself, we've really been working for a long time with so-called, marginalized communities, especially in Hong Kong. I'd like to draw, a case or just like my personal experience while I'm still in Hong Kong, because I've just been in, Cairo for 2 months, so I might not have a lot to add so far. Learning Arabic. So I might like to draw a bit more on my experience while I was in Hong Kong. So when the epidemic first started, in December last year, I was still with the government, and then throughout all these months in 2020, there has been a lot of different initiatives that was very time pressed. A lot of the times by the government because of the evolution of the epidemic. So what I have in mind, for example, is when we have a surge in number of cases, then oftentimes our government had to respond quickly by either modifying their public health, regulations in terms of limiting public gatherings, limiting the number of people allowed to sit in the same table in restaurants, indoor eating and all of that. And an example that I would like to share with you all here, it's remember the day that there was quite a huge public outcry when the government had enforced the ban on indoor eating after 6 o'clock, and also for lunch. So during that episode, there were a lot of media that portrayed a lot of our outdoor workers, construction workers, our cleaners who are having their meals outdoors in parks, on the roads, at the bus terminal, and there was heavy, rainfall. So that was, I think, a scene that we all remember very deeply. So, for example, in that episode, in a way, again, this shows the vulnerability of those who are really at risk. So, in terms of vulnerability, so I think Rohit, you would very much agree that with ethnic minorities, especially, there are things that, when we talk about inclusivity or leaving no one behind, these are the things we're talking about. For example, the messages of these restaurant bans, lunch bans, and the opening of community centers for people to have their lunch. They're in Chinese and in English. But a lot of our workers, construction workers, are the majority, but a lot of them are Nepalese, Pakistanis, Indians, as well as our cleaners. Do they get the message? Are they able to, the ones who are most affected, are we able to effect our messages effectively to them? So our experience from that episode was painfully, they did not reach them. So I think this is an episode that has, it really, is very close to my heart because I've been working with ethnic minorities groups for a number of years in Hong Kong. And there are things that you could foresee and to be able to incorporate. For example, in terms of messaging, are you able to just briefly translate your short message or the list of community centers into our ethnic minority languages? There are a lot of NGOs out there who are able and ready to just help. They're even for free. That's not a problem as long as it benefits the groups that we're trying, to benefit. So these are the things that I believe, moving forward, we really need to put in mind. So ethnic minorities, so language and cultural sensitivity is a huge one. I think globally, not just for Hong Kong, globally, I think this is something that has sprung into a lot of government's minds. For Singapore, it was the migrants, where there were a lot of outbreaks in their dormitories. In the US, in the UK, again, there's a larger number of cases among the ethnic minority groups. So I think one of the key, key inclusivity considerations will be ethnic minorities. So this is just one group that I really wanted to highlight. And then, for example, elderly, of course, and children. Perhaps we could, see what Rebecca and Jessie has to add. But ethnic minorities, that is something that I think we really need to remember, starting from this year, this moment onwards.
Right. Yeah, I think ethnic minorities, obviously, it's a topic that hits close to home for me. And you're right, a lot of marginalized people, we don't really know the message that's coming across. Everyone is trying to jump in to help, but are we doing it the right way? What is the best way to be doing it? How do we accomplish our objectives and our goals in a reliable fashion, in a fashion that is sensitive as well? So I think that's great. I mean, happy to see, Karen, you've talked a bit about the ethnic minority beneficiaries, and let's pivot a little bit over to the live side of today's panel. Jessie, what about your beneficiaries? Why don't you tell us a little bit about the beneficiaries of Family Mask, and how have you been targeting them? How are you building resilience with them?
So the first donation we made was actually before we even started selling masks. So we worked with Polancook of Hong Kong. They're a charity organization that works with marginalized groups, children, and especially women in need. And we have been doing monthly donations to them, and because there are a lot of schools and NGOs under Polancook, so they helped us in distributing the masks. And I'm really glad that a lot of NGOs and a lot of community organizations within Hong Kong reached out to us at the beginning of the year. Therefore, with their help, we were able to distribute the masks very quickly. Also, another thing that I want to touch on, previously mentioned by Karen, that we saw a lot of marginalized groups at the beginning of the year where they did not have the needed resources. And I feel like besides the issue of language barrier, there is also the issue of misinformation from the media. There are a lot of fake news going around, and it is very important for us to first understand how face masks work, the efficiency of face masks, maybe how to choose which face mask to buy. I think the general public needs more information, more clear information from the government instead of from a lot of different media outlets where, you know, if information may not be completely true. So.
Yeah, that's pretty interesting. I think actually even in the medical sector, you know, knowing kind of the levels of the masks and the different grading and classification, that's actually new for even us.
Yeah.
How about on your side? So which particular types of masks are you doing, and how is it like the grading or that process like for you?
I mean, it's been a very interesting learning process because it's new to me too. And I feel like I've learned a lot this year, being from a non-medical background myself. And there are actually very different types of grading. So there would be a different scale of measurement in each country. And sometimes people will come in asking for example, our masks are done tested with the American standard of ASTM levels,
right.
And also I think it's the European one, right, with the EN standards. And a lot of the time people come in asking about like Japanese standards, and they'll be like, why didn't you do the tests according to the Japanese standards? So I think people maybe need more information regarding that.
Mm-hmm.
Yeah.
Yeah, it's a completely new area, I guess.
Yeah.
Yeah. Rebecca, why don't you tell us? Because I mean, you know, you've not just done work with the Golden Age Foundation, but you've done work with all kinds of social enterprises. You've had such a long and beautiful experience contributing to the community through so many different ways. Why don't you tell us a little bit about your experiences and the beneficiaries you've been able to touch all this time and how you've been able to build resilience with them?
Yeah, I'm very moved because during this period, there's a lot of help and then innovation coming up from the grassroots level. Actually, it's the citizens themselves that come up with new ideas to help each other. So I feel that it's very important that we encourage more bottom-up innovation and to empower people, even though if we feel that they are helpless. But in fact, everyone, if we're given the chance, given the needed capacity building assistance, they could be able to help themselves. And then when I look at the social enterprises, even though they had a very difficult time because almost over half of them have lost many businesses and they are beginning to stand up again on their own feet with new business models. However, they still struggle to survive, and mainly because they feel that they have to fulfill their social mission. And many of them say that even if they don't have any income themselves, but they would still like to keep their staff because they still have to maintain their families. I think this is this determination that keep many of us going. And I'd like to stress that social interaction is the key to resilience. because if we feel that we are not alone, there are people around us who would like to help, and we could communicate with each other. We could let each other know our needs and our advantages and how we could help each other. So we see people in Italy, in Spain, in Israel singing across the streets and over in the balconies when they were facing the most difficult time. And even in Hong Kong, we are giving encouragements to medical staff when they need help most. And then for those elderly people, some of our volunteers will organize small groups to call on them. And also some of them may even visit them when they want to. So I think social interactions is very important during these difficult times. And I'd like also to follow up on what Karen has just mentioned about ethnic minorities, because recently I have held a focus group study on the ethnic minorities, especially among the elderly, because during the pandemic, actually, many of them are facing health issues. However, because they don't speak Cantonese, they don't understand English either. So these people will have a difficult time having access to medical assistance. And this is one area that has magnified itself during the pandemic, because previously it seems that people are okay, but now during the crisis, we've seen that these elderly from ethnic minority groups, because they speak different dialects, some are from Nepal, some are from Southeast Asia. So we don't necessarily have the professionals who understand their language or their dialects to help them. I think so this is one thing that we should think of. Can we train up ethnic minority young people so that they could act as a bridge between the elderly and the society, because they speak both sides' languages. And also, during the pandemic, we've seen that nurses and doctors, they are so overloaded. It also shows us that, do we need any more professionals, or do we need more generalists, like healthcare workers could help not only the elderly, but also the disabled? Because they don't need 6 years of training like you. Maybe they need only 1 year of training. But to my surprise, when I look at what the UGC has done, they only supported around 40 students to be educated as medical healthcare workers over a period of 2 years. This is very slow, because in the future, we will have around 300,000 people who may suffer from dementia in 10 years' time.
Right, absolutely.
So how many more healthcare workers do we need? You could imagine. So it's not only a matter of the crisis, but when we look at the future development of our city, even without crisis, we need so many healthcare workers. So are we prepared for this? And how are we going to deal with the elderly from ethnic minority groups and elderly who are disabled? And then if there are crises, if there are another virus attacking us in the future, so what should we do? I think all these problems are very clear to us now. So we really should, I think the public sector and the private sector should really work together, collaborate together with partnerships, and see how we could find a better way for our healthcare system.
Mm-hmm. Well, I think that's great. I think recently in the news it's come out that I think the UK found another strain of COVID-19. So we don't know what that means for the vaccine and what it means for immunity. And of course, what it means for this battle that we find ourselves in, which is going way longer than we thought it would. It's already a year. COVID's already had a birthday, and I mean, you know, everyone's been dealing with it in its wake. Karen, I wanted to definitely sort of reroute a little bit to you, because we've talked a bit about businesses and we've talked a bit about communities here, especially with the elderly. Karen, what do you think regarding the policy perspective that can be done with respect to resilience, sort of resilience building within the community?
Yeah, Rohit, I think in terms of policies, it really is building in that angle of inclusivity and being sensitive to relatively marginalized groups. And I wanted to echo what Rebecca was mentioning. I agree completely that definitely we of course need specialists, but definitely we need a lot more generalists, or just people who have a basic training in public health, or community healthcare, because I think it's also a way of empowering the community, because oftentimes, especially Rohit, you would know in healthcare, the traditional paradigm is relatively, hierarchical, paternalistic. People get sick and you go to the doctor, you look for advice, someone gives you, healthcare professional tells you what to do, you follow it. So that has been the traditional, approach. But I think, nowadays we understand that basically everyone has their comparative advantage. For example, riding on again, the comment on ethnic minorities, we really have to, look at things in a different way in terms of the comparative advantage or as a resource. So everyone is a resource. Like you said, Rohit and your peers, young ethnic minorities, as Rebecca mentioned, you have the connections, the language, you have the, community relationships. That's where even as a medical student, it would benefit greatly if you could, share your, health, basic knowledge. You don't have to be, a cardiologist to be able to share public health information, correct, fact checked public health information, of course. But I think looking, in this perspective where everyone can be a resource because we're all embedded socially, in the fabric. You might be in a certain community, living somewhere in a certain, social class. So everyone has something to contribute. So I think, linking back to policy, it's about knowing how to leverage community resources and networks, because in the end, government, even if we, implement a policy, we need a collaboration, cooperation, and trust of the entire community in order for it to succeed. We've seen how, not with COVID, but previously, a lot of anti-vaxxers, mistrust and misinformation around, measles vaccines, and then more recently with COVID, a lot of societal resistance towards lockdowns and that sort of measure. So I think, moving forward, I would really like to see, state actors to be more sensitive towards what the community's concerns are, their worries, their aspirations, their cultures, their perspectives. So really being inclusive and thinking a bit more, in the design phase of the policy to anticipate the responses. So I think, building in that approach of social inclusion into early on in the policy development phase would save, us a lot of trouble downstream, in an upstream, downstream, perspective of things. So in order for policies to really be able to benefit the community, I think in the beginning phase, we really need to see how we could incorporate their voices. It could be directly, engagement with the communities, focus group, town halls, online, polls, Facebook. But I think with COVID, because of the timeliness, NGOs definitely is a valuable resource. That's our comparative advantage. NGOs in the community in Hong Kong, overseas, have worked for so many years in their respective fields. So for example, elderlies, not only ethnic minorities, but low-income families, Tao Fang Wu, people living in subdivided units. So all these different groups, there are NGOs who are very familiar and with the correct, relationship or appropriate, position to be able to bring them in. So I think leveraging that bridge, civil society actors and NGOs as the bridge between the state and marginalized communities will be really helpful in tailoring and fine-tuning policies moving forward. So I think again, this would be something positive from the whole COVID experience, where you could really see how traditionally less involved actors in the policy phase could actually really benefit not just the government, but in terms of outcome. So that would be my take on the question of policy.
I mean, it's a great point. I feel like there's a lot of youth that needs to be sort of engaged as we, sort of try to deal with the upcoming challenges, especially with resilience. You mentioned a lot about anti-vaxxers, and now we have the new anti-maskers in parts of the world. So that's a new group of since Jessie, you're here, being involved with masks, how would you say that the image of masks, in the sense of how that has maybe evolved for the people of Hong Kong or the people of the world? And is that related to, say, the resilience that has come about it?
I mean, the reason I started this company and named it Family Mask was because I wanted to change the idea of mask being, you know, for sick people, and wanted it to be an idea where it would be, if you wanted to protect the ones you love and if you wanted to protect yourselves, you should put a mask on. So, and I feel like our business model has also shifted because of that. We started making the traditional surgical blue, like the one you're wearing.
Right.
And then slowly we've kind of added an element of fashion into it. So now you're seeing all kinds of prints, like the one, Rebecca, you're wearing. Yeah. You're seeing all kinds of prints and fashionable face masks now. So I believe anti-maskers are not a huge issue in Asia, I believe, because a lot of cities are already used to wearing masks pre-COVID. Let's say, for example, Bangkok, Vietnam, especially where in cities where the traffic is especially high, people are used to wearing masks. So I feel like a lot of people here see it as a form of protection, just, you know, from general dirty air to the pandemic. But I feel like this concept needs to be further on, you know, widespread internationally.
Right. I mean, you know, the mask has become a symbol for how we're dealing with the pandemic. So in essence, it's definitely become a mark of resilience from a mark of sickness. And that's something that we note. I mean, this has been a great discussion so far about resilience. I just wanted to tell those of us online, if you have any questions, you might want to start putting them in the chat box as we start to wind down the second theme and move on towards the takeaways from today's session. But yes, Rebecca, I wanted to go back to you really quick. What do you think about, you know, the resistance to masks and vaccines? Do you see that a lot in Hong Kong? I mean, you're dealing with a very broad population. I imagine those that are younger are like, you know, we'll just take the jab because, you know, we have a childhood immunization program. And I mean, we go through that in pediatrics. We have to know that in and out. But how do you think that those older are looking at the vaccine? Is everyone generally very receptive towards the vaccine, or are people not very convinced? What about yourself, actually?
Well, I think in general, Hong Kong people learn a lot from the SARS experience 17 years ago. At that time, we were also very worried and taken by such accident, and people didn't really know what to do. But then because of this experience, when we are facing the COVID-19, then people immediately put on the mask. So there is no resistance on putting on masks. And as for vaccinations, because there are various reports on the effects of these vaccines, and because they are so new, they are not evidence-based yet. And there are news that some of them have negative effects, long-term effects on people who take it. So I really would say we should rely on scientific evidence and scientific data, see how effective these vaccines will be. But then in the meantime, I think everyone should stay alert and protect ourselves with putting on masks and washing hands and keeping social distancing. But having said that, I feel that in the long run, we need to coexist with whatever virus that may come our way. Today is COVID-19, maybe a few years later is COVID-20, we never know. But I think I think the virus will appear anytime. So we have to be prepared to coexist with this virus, but at the same time, we really need to reflect on our way of living, on the way that we produce things, and on the relationship between man and the planet. In many ways, I think this pandemic has shown us that we have not protected the planet well enough. But I don't want to be too philosophical on this issue, but it does give us a lot of thoughts on can we develop a sustainable way of living without putting too much damage to the environment. And also, I think in the long run, we need to empower everyone to be a change maker, especially during critical times. And also we need to, because the society and the economy is developing towards a stakeholder economy, which means that no one should be left behind. And then we should develop an inclusive economic, medical, and social system where people could live in a safe environment.
Right. I think that's a really great reflection, Rebecca. So I wanted to start to wind down on our second theme. So we've talked a lot about different types of resilience. Resilience has different faces. We have the policy side of things. We've talked about the youth. We've talked about the elderly. I have to say Hong Kong elderly are the dragons of Hong Kong. They've been through so much, from financial crisis to pandemic after pandemic. So I think they've got a lot of resilience, and it's great to see such great ideas come out about how we can interact with the elderly, or how we can bridge the youth and the elderly together, because resilience is a community unit. It's not really solely an individual thing, because, you know, at the end of the day, like you said, Rebecca, it's a virus, and it's part of our reality now. And how we move ahead from here needs to be a collaborative and conjoined effort. So on this note, I wanted to just check to see if we have any questions online. Can we pull up the questions online, please, if we have anything? Okay, I'll need that to be zoomed up. Like a lot zoomed up. Okay, great. Right, I need to get in with the tech. Great, I have like a phone here where I can do that. Okay. So we'll try to rapid fire through as many of these as possible. Okay, question for the panelists. How do you think moving everything online links to the UN Sustainable Development Goals? In particular, how do we deal with problems such as unequal access to the internet or online resources? All right, I think, shall we have Jessie take that question? The SDG pin, so it's for you.
I feel like this is a similar issue with poverty and food. It's where this year has been a wake-up call for everyone, like Rebecca just said. And I think this is the moment where we realize people who are lucky enough to have these resources should be sharing with others. And I feel like this year, a lot of the UN's SDGs have actually been highlighted in a lot of work that has been done around the world. Is that...
Yeah, we can go ahead.
Yeah. In a way, the widespread of everything becoming online and the education of the SDGs, it's also, I think, inspiring a lot of people who have the power to act. Like you said, we need more change makers in the world, and I believe more people are becoming change makers because of what happened and because of accessibility, because they are able to be part of these change-making programs online.
Yeah, I wanted to just reactivate the screen in front. All right, so, okay, that's great. I hope that answers the question. I think definitely inequality of access is something we've kind of touched upon throughout the discussion, and kind of how people will take to computers and how do we deal with the problems. Things are rolling out as they go, and I think we've talked a little bit about the SDG perspective. So I hope we've been able to touch on that sufficiently. Of course, it's a very broad question because every country, every city has its own fair share of challenges. I'd want to move on to the next question, touching up on the idea of partnership. How does the UN suggest to encourage a multifaceted partnership with both public and private sectors? To Rebecca and other panelists. So I'll let Rebecca take it first, and I think Karen, obviously with the UN reference, I have to, you know, kind of get you in on this one too. Yeah, Rebecca, what have you heard about any international sort of guidelines to make multifaceted public-private partnerships, or what's your experience with public and private collaborations?
Well, in Hong Kong, we have been talking about this over the years, especially on elderly care. As you may know, in Hong Kong, we have a number of privately run elderly homes, and then the government also provides subsidies to these elderly homes, and then those who are in need can apply for government subsidies. However, a lot of privately run elderly homes, because of the huge running costs, so understandably, they are limited in space and they are limited in resources. So we have been discussing this over the years and see if the government can provide more subsidies so that these privately run elderly homes, they could use the government subsidies to expand the services and upgrade their qualities. But then, well, we have some improvements, but not that much. So in this respect, I think that if there is government policy support, actually the private sector could provide more services to the elderly, not only for elderly homes, but also for soft meals for the elderly. And also the private sector could make use of these government incentives to develop new products and services through scientific research and through product development. But then we see very little improvement in this area. So I think there's huge area for collaboration between public and private partnership in this respect.
Right. Karen, how about from your end? Has the UN particularly suggested anything regarding partnership? Not sure if this is particularly referring to just the pandemic or in general. Have you been able to pick up anything on that in your time with the UN?
Sure, no problem. I'll chip in. I think in terms of what I mentioned with WHO's experience, we have FENSA. So in case you're interested, you can look up. It's FENSA, FENSA. So it's a framework of engagement with non-state actors. It's sort of the agreements that guides WHO in working with private sectors, because traditionally, as we can all understand, governments, including intergovernmental organizations, there are certain considerations before working with private sector. But increasingly, the private sector is also a very diverse area. So it's of course it's multinational companies, but it's also foundations, different enterprises, social enterprises. So it's becoming increasingly diverse. And again, at the beginning, I remember Rebecca mentioning value-driven enterprises. So if I think that if state actors and non-state actors are able to identify commonalities and shared values, it would be a lot easier for them to work on a project. And I also think in terms of actual experience, it really is about innovation. So and looking at innovative practices or approaches which leverages states and non-state actors' comparative advantage. So I remember one of the interesting examples I always like to quote is in terms of delivering vaccines. Oftentimes we need to have cold chain management, storing vaccines in a low temperature. And in Hong Kong, in the States and UK, it's relatively easy. There are challenges, but it's relatively easy. But in terms of regions that we work with more here, and low and middle income families, it's countries. It's really difficult because electricity, the Wi-Fi is not stable here. It's not easy to be able to ensure an end-to-end cold chain. And if there's any compromises in the middle, basically the vaccine will no longer be effective. So that is a huge challenge. And I remember one of the examples was that there was a collaboration with Coca-Cola, because Coca-Cola is very ubiquitous in a lot of low and minimum countries. And just right on it, they need cold chain storage as well. So put the vaccines in, and that was actually one of the successive innovative private-public partnerships that I could remember. So yeah, I would think that definitely PPP, public-private partnerships, are the way to go in different levels, country level,
Right.
city level in Hong Kong, and also internationally. And I think it really is about identifying comparative advantages and then managing risk, and moving towards a project with common values.
Well, it's great to hear about FENSA today. Definitely something I learned for sure. I mean, that's really amazing to hear that the UN has gotten involved to that extent. But you're right, with the storage of the vaccine and how it gets transported, that's also part of the challenge going ahead, right? All right, so we'll move on to the next question by Shan Dizon. I hope I got the name right. SARS happened more than a decade ago in Hong Kong, which is very similar to COVID-19. What physical or intangible changes have you seen your country has done in response to SARS? Can you say that it made a difference on how the country dealt with this new strain of the coronavirus? All right, I think I remember Rebecca sort of mentioned a bit regarding SARS, so maybe we can have Rebecca take this question for us.
I think time is different because when we were facing SARS, it was 17 years ago. We have less digital tools to help us. So nowadays, now we have the digital information. So the news could spread really fast. And also because of the widespread of information, people could take precautions more easily. Because I remember during the time of SARS, we heard from the news that people in Canton, they are drinking vinegar and they are also burning vinegar.
Right.
So we're wondering, what are they doing with the vinegar? And then it's afterwards that we knew that because of the virus outbreak. So that is something very traditional. And then during the times of SARS, we don't really have that a lot of medical equipment. So I remember Mrs. Chung, the then wife of the chief executive, putting on all the protective gears and then leading a team of healthcare workers to clean up the air state that was being suffered by that was polluted by SARS. Yeah. But still, nowadays, we had similar problem at the early days of the pandemic. If you still remember, there are some medical professionals who complained that they didn't have enough protective gears to protect them from their work. And that is something very clear in my mind that our government is not prepared for this, even though we have the experience of SARS, but when it comes to the pandemic, maybe no government is prepared for this.
Fair enough.
Yeah. So I think that looking forward, our public healthcare system should look for ways to stock up these kind of protective gears. And also, when the pandemic broke out, it was during the time of the Chinese New Year. And all the factories were closed in China. And that was really panicking for everyone.
Oh, of course.
Yeah. So of course, we have to take this into consideration as well. Should we focus on one production area, or should we have diversified production plants in different parts of the world so that when different countries are facing similar disasters, other countries could chip in and help? So I think that now it's not a matter of government, what individual governments can do, but I think it is a shared global responsibility when we are facing crisis that each country could help each other out.
I hope that answers the question, Shan, if you're still on the stream. We have one last question by Divya Kumar. Okay, so if you want to know who's gonna let me do impressions, that was her. So it's from family. So the question is, with the exponential increase in the use of masks, how would you best recommend the management of the increase in the medical wastage, and especially from an environmental perspective? Thanks in advance. I think, Jessie, this question is asking for you.
Yeah, it was actually something that I wanted to address earlier as well. It's the issue of sustainability versus disposable masks. So as a doctor, I'm sure you know that cloth masks are not as effective as the disposable surgical masks that we're wearing.
Correct.
And obviously there are people who prefer a cloth mask, but that goes back to the question of education and the widespread of knowledge from the government. And I think one thing that we can all do at home is that make sure when you take off your mask at the end of the day, wrap it up or cut the strings, and before you put them in the bin, because that really does help a lot. And I mean, when you do see scattered masks around the ground or around the seashore, wherever you see them, pick them up and put them in the bin.
Yeah. I mean, I guess there's a lot of day-to-day that we can do, you know, sort of going ahead. and how masks become part of the new waste that we produce and how it takes up a greater proportion of the waste we produce will definitely change the landscape on that. I think we got a quick last question. Karen, I think I'd like to let you take this one. In a post-COVID-19 pandemic world, what new social changes do you think should be part of the new normal that will help make sure citizens and businesses can be prepared for the next pandemic? Aryan, right?
Sure. I think
Thank you.
that's a
Thank you for
great
the question.
question that brings us towards the end of the session as well. I might, in view of time, I might include my concluding remarks in answering this question as well.
Sure, absolutely.
I think based on an hour and a half discussion, a key message that really rings the bell is inclusivity. So in terms of, back to the question itself, new social changes, that's part of the new normal. I really think no matter which sector you're in, so the public sector, private sector, NGO sector, it's really about, working together to foster partnerships in an inclusive manner. We talked a lot about, especially the experience of ethnic minorities. So it's not about moral imperative itself. So whether it's right or not to exclude certain groups. But as the COVID experience has clearly shown, by the exclusion of certain groups or perspectives in your policy design phase, there is bound to be consequences for everyone. So I think epidemics are interesting in this respect because people say virus knows no boundaries. It doesn't recognize your race, your religion, your gender, and that is very true. Viruses or generally communicable diseases has this one feature where often the risks are centralized on those who are most vulnerable, but eventually the risk would propagate and would spread and spill over to the other groups as well. So I think if there's one big and painful lesson that could be distilled globally, in Hong Kong from the COVID experience, it's really the need to take into account socially marginalized or socially excluded groups in all phases of policy implementation and design. And as different panelists have alluded to, whether it's children not being able to access certain internets, or the elderly not being able, ethnic minority elderly especially, not being able to actually understand public health messages, without taking into account all these different needs and characteristics of our marginalized groups in a society, in the end, what's going to come down to it's going to come to you, Rohit. So it's the public health sector that's going to be burdened. So I think it's really helpful to think of everything in terms of a broader systemic thinking, where things upstream, downstream, they interact, and also laterally different sectors, whether we like it or not, we are all interlinked. So I would just end my the answer to this question, but also to my key message that we really need to build in this angle and this systems thinking of inclusivity in all aspects of our work, work and even outside. So without this, perspective, we're going to repeat mistakes and tragedies. So it is a cliche, but with the SDG, we always talk about leaving no one behind. And I think with our year of COVID, experience, painful, it really shows that this is really not, it's not empty words. We really need to leave no one behind in order for everyone to do well. So yeah, on that note, I would pass it back to the Lifehouse in Hong Kong. Thank you.
Sure, shukran. All right, I mean, Aryan, great question. You're making my life easier here. So Jessie, what do you think? In the post-COVID-19 pandemic, what new social changes do you think will pop up? So basically, the kind of takeaway round was about what's the challenge in your future city and what's our takeaway from today that's going to borrow into that. So Jessie, I'll have your concluding remark.
So as I mentioned, a lot of times everything will be moved online. A lot of things will change because of that. Like you said, education is no longer what it was. Everything has been changed. So I believe with the pandemic and now with the new sense of urgency for the world to connect, we are able to we are able to have more partnership and collaboration opportunities.
Right. I mean, thank you so much, Jessie. You've definitely brought a lot in terms of your business and how things have changed for you and how you've been able to make an impact. And definitely the SDGs is about leaving nobody behind. So definitely special thanks for your contributions today. Rebecca, what about you? What do you think about the post-COVID-19 world? What's your takeaway today, and how will you deal with the challenge to your future city?
I'm sure people from different positions, they will learn different lessons. But I've seen that during the entire period, there is a disconnection between leadership and power. Especially our leaders, they don't really connect it with the society. We have seen a lot of examples, as Karen has mentioned as well. So I think for leaders to really understand about the needs of the society, they need really to make use of what we call the new power. So new power is not the institutional power that we used to know. It is from the grassroots level, because everyone, they have their own ability to change. And then they may have new ideas, they may have new ways of doing things. So if we could harness on the new power and then help these people to grow, then the help will come from the community itself, instead of having the government has to do everything. Well, in fact, in many cases, governments are also vulnerable. And then I think we should help ourselves from the grassroots level at the community level. And at the same time, I think my key takeaways are, first, we need to empower everyone to be change makers. And second, we are gearing at an inclusive society where the most vulnerable groups, the most marginalized groups are being taken together as part of the community itself.
I think that's a great contribution from your end, Rebecca. And thank you so much for participating in the panel. So, as we wind down, I wanted to sort of share a closing message with everyone over here. I mean, in general, we've gone through about urban health planning, about resilience. We've talked about a lot of different things, and thanks to a lot of the wonderful questions that have come in today, we've learned a lot from things like FENZA all the way to, how public and private partnerships can happen, what's happening among the elderly, masks and what that looks like, and the new image of masks, and what will be in our post-pandemic world and our future city. I think we've definitely traveled a lot in this sort of almost 90-minute journey that we've had together. Now, I have to say personally, on a more personal note, this year I've had an opportunity to conduct TED Circles, and we kind of connect with people all across the world, like this, kind of with people online and in person. And I definitely feel really privileged as a moderator today to be gathering everyone's opinions, because for me, I definitely had the best piece of the pie. You get me to sit down with three amazing, beautiful ladies talking about their visions for the future and about what the new world is going to be and the new normal is going to be. And on this amazing platform, I definitely want to say thank you to everyone that's tuning in. But before I close, I definitely want to say thank you to everyone on the team that's behind the screen. Everyone has worked so hard for the past couple of days, and we really, really appreciate the kind effort and everything that you guys have been doing. Obviously, as someone that's done conferences, without each and every one of you, this would not be possible. So on behalf of all the panel, as well as myself and Future City Summit, I hope you guys have had a great journey going through these different aspects and have been able to take things from this into your vision for your future city. And that's why I think this is probably one of the best panels to close the whole summit on. And I hope you'll be taking positivity and optimism from this panel, particularly from comments like 2020 wasn't that bad of a year, and taking it into the future. Of course, 2021 is just on the horizon, and like every year, we have what you call New Year's resolutions. I don't think we'll be taking off our mask anytime soon, so please keep them on. Please be safe. Please maintain social distancing. Obey all government guidelines, and please take care of yourselves and those around you, because we want to celebrate the new year together, better, stronger, and with a stronger mindset for our future city. So with that said and done, from your moderator, Rohit, today, thank you so much for tuning in. And I guess this is concluding our panel today. Thank you so much. Thank you.
Thank you, everyone.
Thank you.